I'm Nita. I've been clinically diagnosed with a heart condition, and they were disabling symptoms, and I was clinically diagnosed with microvascular angina or heart disease. I just knew there had to be some relief somehow, and I researched ECP when I went and found out that it's been around for a long time, and that it's first standard for angina care in the States, and we don't even know about it here, and my cardiologist didn't even know about it when I asked her about it. So when I found that out, I knew and then I researched it myself, and I'm like, this makes perfect sense, I have to get this done. And then finally I was able to take the time and the investment to come here. And the prescription for heart disease is exercise, but when you don't have the function to be able to even do it, it would knock me out for weeks and weeks, right? So if I have this testing, which is non-invasive, easy, and it's like, it really seemed too good to be true until I experienced it all. And I think the most simple things are really true, and they are that good. But until I experienced it myself here and have had such an increase, I went to the gym, I was telling you the other day, for the first time I was able to work out like I did before, and I couldn't have dreamt that before ECP. And one of the nurses told me that I'm not even where I'm going to be results wise, because she said that my blood vessels are going to be, angiogenesis, up to 6 to 9 months. She said you're going to even be getting better results.
Yeah.
And I was just like, wow, I've been able to do 20 minutes not stopping cardio, and that was 2 days ago. That would knock me out for 2 weeks. This is what ECP does. But I did the research, I was interested, I knew I needed to do this, but there is still is this really gonna work for me? Because my quality of life, my energy, I'm suffering, is anything gonna help? I've seen every doctor in the sun, been in and out of the hospital, been told it was anxiety, a pinched nerve, no. But until I actually experienced it and am experiencing it, it's amazing. And now I feel like I have a new passion in life, is to really help people to avoid the suffering that I've avoided. And something you said on your website really encouraged me, that there are heart fit patients who live with heart disease well into their 90s. It's not a death certificate. And if something like this could spread and it's really, you said we're the gap in cardiac health care, we're filling in the gap, we're what's missing. I was like, but then I've been programmed by what we know, but what we've been programmed by is 70 years antiquated. So yeah, I have hope. I'm so grateful. And I just want to spread the word, because I know people can feel better. Like I have a life now. So I was aware, as with everything, that results can vary. However, already on the 7th treatment, my heartbeats per minute, because according to what, the EKG during the treatment, dropped 8 beats per minute by the 7th one, and my blood pressure points are almost down. They're down 10 points, I think a little bit more now. And my blood pressure is almost down to what it was before my life changed overnight and I had that big cardiac episode. So to have my blood pressure in that, to have been able, I was even saying to my friend, I'm waiting for the shoe to drop. Why am I not so tired? I had to fight just to work out once a week and do 2 or 3 sets per body part. And it was in the last month, I've been able to do like 3 and 4 times a week. And then, like I said a couple nights ago, work out like I did. And the thing is, anybody at any age, at any time, can have a cardiac episode. Look what we're seeing everywhere. We don't know why all these people are having all of these issues. And I'm just glad that there's something here, and it's always been here. But why aren't we more well known? Well, this is your 3rd location. I really think that as more people find out and more people talk about it, more awareness and whatnot, I'm just really excited to be part of telling people and sharing in their journey and being able to celebrate life. Like, I have hope. I couldn't leave the house more than twice a week before I came here without having to be, if I had something to do, like a grocery shopping trip, I'd have to make sure I rested for a good 2 days before. I'd go out, I'd do my thing, or I'd do a little 2 or 3 hour shift of work to see my stamina. I started that 1.5 years ago. And then I'd have to recover and like book in recovery days, which were just laying down and resting. Like, what kind of life is that? And doctors were saying, well, you're too young and you're so fit and all of this stuff. But again, if you know what's going on with your heart, my friend's mother just had a massive, she's in her 70s now, a massive near fatal heart attack, and I think she had stents on, like, I don't know, triple bypass, or I don't know what it was, but something major. She almost passed away, but she's been complaining to her doctors for years. I had every test under the sun. I had a horrible reaction to the dye, like sweats and hives, and I was sick. One of the tests, it was another dye test that put adrenaline in my heart to stress it and to see and then take pictures. Everything was normal. And they were telling me everything was normal. But you know your own body better than anybody else. So all of those awful tests that just made me sick and all of that aside, but I got this scan that you brought on here, and do you know what amazed me about it is it pinpointed the exact location. When I went through the results with one of your cardiac nurses, she said it shows a microvascular. So it was a really easy test. It didn't hurt. I just had to lay still. First of all, your testing here was non-invasive, and it didn't knock me out for 3 weeks. The hardest tests in the system, I'll never forget the adrenaline in my heart test, dye and all of that, and just how much it hurt and how exhausted I was and how much my heart hurt. They're like, we're gonna purposely put adrenaline in your heart and dye and take pictures, and oh, by the way, just be prepared, at least I was told, it's going to hurt and it might knock you out for, a few days. Here, it's that easy. Oh, there's an arterial stiffness test when I first came. Everything is advanced and non-invasive. Why is our system set up just to find full-blown heart disease in a way that they use still, that's 70 years old, that hurts people, causes like sickness from the dyes and more fatigue, more disability? I don't want to stress out and worry about all the tests and radiation I've had done, but it could have been avoided, and I could have avoided all that radiation, all the dyes. I've been in and out of the hospital over 6 times with disabling angina, and the thing is, here I felt listened to. At the hospital, they're like, oh, well, it's still normal. The normal was high normal. I went from having athletic numbers, 95/65 blood pressure, which I'm almost there now again, to 130/80. Like that overnight with a cardiac incident, whatever happened here. And they weren't listening to me, and they're saying it was normal. well, you look at the percentage of the margin that you jump, that's not normal. The cardiac nurses, they listen to you, and their biggest thing is, we're not going to stress your heart. We're going to see where your heart numbers are at. I can do my weights 4 days a week. I can do cardio. I couldn't walk more than 10 minutes, 12 minutes before, and then it knocked me out. I did 20 at like an athletic, and I did it twice this week too. And this is what's happened. So my energy started increasing around the 4-week mark about a month ago, and I was able to do more. So energy, my mood's way better. That's just a side effect that you don't even think about, but it makes sense. Blood flow, brain, right? But yeah, I can work out like I used to. My cardio, I can do for 20 minutes, and I'm just excited to get even higher. So now I'm actually going to be able to do the, 150 minutes of, exercise a week is what is prescriptive. Well, how can you do that? So now this is something that I'm able to do. I can socialize. I can go for walks. I'm talking to my friends again more because I've just been too tired to do it. Heart disease is extremely exhausting. Yeah. And also I had adrenal issues, but everything has improved. My energy, when I read and when I saw testimonials like, yeah, I have more energy and my points are down, it's like you hear it, but then it's like, I have energy and my points are down. Like, that's really it. So I can just, like, I'm even with my friend, we're even talking about meeting at the track 3 times a week. I couldn't have dreamt of that before. A heart scan, the arterial stiffness, there's an endothelial wall dysfunction. And a really big thing is women in their 30s, their hormones start to change, and with the estrogen and progesterone decreasing, even before perimenopause, that is the endothelial wall function, which is the muscle, muscle, not a pipe, right? And so the contractibility of the heart, there's a test here that can tell, and a nitric oxide test to see how much nitric oxide your heart and your system is producing. It's so simple, right? So you can really see if somebody's just kind of overly tired. Oh, I'm just stressed, or maybe I'm a new mom. There's somebody who's 29 I just met who wasn't taken seriously. She was a new mom, and she had microvascular heart disease starting. But because she was young, because everything was normal, she wasn't taken seriously, right? So the testing at any age, I'd say especially young people, and especially but people are dropping left and right. I know it's a little doomsday, but there's someone in the news you hear about every day, too young, who's had heart disease. Our symptoms are a lot different. Our hearts are smaller. And the reason why I've learned through the education here, and the horrible experience I've had with our antiquated system, is all of the testing that's 70 years old, and the model that was made, and the blueprint we have now is all on men's hearts. Men's symptoms are different. Women, I think just for the fact that we give birth, we're created for birth, have a higher pain tolerance. Women's hearts are smaller and our symptoms are different. They're not as, you think of a heart attack and right away you think sweating, grabbing your heart and falling to the ground. There's somebody I met recently who it just felt like she was being grabbed by the throat, and she was having, what's it called, a widowmaker heart attack. So thank God she got to the hospital, but she also said it just felt like something was tight around here. It's a miracle she's alive. She had that main, and I guess it's in your main aorta or something. But yeah, it's just, women's hearts, you don't want to fool around with it. But especially 30s, 40s, our hormones are changing. You want to get that endothelial wall function test, the tests here that can really look at the simple things. It's so simple. It's easy, it's non-invasive. And it sounds too good to be true, but it's not. And if I could even talk to anybody and help them and let them know along the journey how it was. Because there's way through, I was like, oh, but it's like, keep going, you know, because you want the results. But this is going to be a lifestyle. It's something I'm going to want to do for the rest of my life. Whether I recycle in 5 years, which or I do maintenance, or maybe once a year do maybe 10 sessions. It's something that I'm always going to be wanting to do. Try it, please. You got to do it. And it is something that this person is worth it. If you feel discouraged and like, I just think people need to do it. There's no one that can help. That our current system has failed you or not listened to you. You have nothing to lose. Try ECP and stay the course. It's an investment in time and health. It's tiring at first, but it's well worth, you know, the 2 weeks of your heart getting used to accommodating all this new blood flow. So, you know, just to get better, I felt really tired first, like exhausted, tired. But you got to do it. You have nothing to lose and everything to gain, you know. People who have grandkids, people who are young like me, who aren't taken seriously. Even if I knew this was here 5 years before this happened, knowing there's heart disease in my family, I would have loved to come and seen my risk, because maybe this could have been prevented. And even if somebody is really feeling great and healthy and has energy, well, why don't you come and get a scan and see where your risk factors are? Because what I've learned is 8 to 10 years before a heart attack or stroke can be prevented by the advanced testing that's here.